What's up guys, Lee Skinner here with Physio Remedy at Iron Ground Gym. This video we're going to go over shoulder pain, specifically with the low rack squat position. I'm going to go over the two most common reasons for this, and then I'm going to cover some of the training errors I see people doing as they're trying to fix their shoulder pain in the low rack squat position. So first let's go over mobility problems that we see with this, okay? With the low rack squat position, you need to have enough external rotation of the shoulder, but you also have to have that motion maintained as you adduct the humerus bone and bring it down to your side, okay? So one of the tests we'll use is called the W test. Okay, now if you guys have seen this before, make sure you know how to do it right. So we're gonna go over how to do it right, okay? So you should have your butt, your shoulder blades, and your head against the wall here, okay? Your arms up in this position, straight out from the side. You should be able, keeping your back, shoulder blades, and head on the wall, to touch your hands to the wall here, okay? Now if you can't, or if there's a different side to side that you're noticing, then that may be a mobility issue. Now we have to go further than that though, because look, up in this position, this isn't where we squat. So the W test brings your arms down to your sides, okay? Now, what I see a lot of people doing as they do this, is they will flare their ribs up like this to try to make this happen. This touching the wall is not the same as this touching the wall, okay? So when you're doing this test, if you can't maintain that smooth glide up and down as you're in this position without extending the wrist back or without arching and flaring the ribs, then when you get under the bar, yeah, you're gonna have a little bit of a position where you're arching the back, but you have to tuck your arms down. So if you don't have it on the wall here, you won't have it under the bar either. Okay, so we have to train shoulder mobility up in this position, and we also have to train it down in this position, okay? So that's the test. Check side to side, see if you can stay on the wall, see if there's a different side to side. If you're more limited on the side you have pain, you may have found the mobility problem. Okay. Now we're going to review a few shoulder stretches and a couple mobility drills for the shoulder to try to gain that motion, that external rotation at varying degrees here with this humerus bone of adduction. But first I want to go over the most common mistake I see. Now there is this concept called arthrokinematics that says that if you rotate backwards here, okay, then my shoulder joint should glide forwards. And arthrokinematics just looks at how joints move, glide, rotate, spin as we move our body. And most people are under the impression that if I want to gain that, I need to glide forward and I need to stretch the anterior part of my shoulder capsule. So I see a lot of people hanging their arm way back here, or they're doing drills where they stretch aggressive external rotation and pull the capsule forward. Most of the time, it is not the anterior capsule. Most of the time, it's the posterior capsule. And we've seen that with some of our studies that look at what glide can we provide to the joint that produces the most external rotation. And what we found is actually posterior glide does it more than anterior glide. So, stop stretching your shoulder like this. I have very, very rarely found that to actually be an effective, meaningful stretch, and most of the time it just causes shoulder pain to increase. So we'll go over how to provide a posterior glide to the humerus as we're rotating back, and then we'll talk about how to stretch the posterior capsule. So what I have set up here is a band. I just have two posts here. This is a little squat rack. I have a band set up here, roughly at shoulder height, slightly above, slightly below. Slightly above or below won't have a big consequence, but what I want you to do is you're going to take this band, you're going to find that bony part of the top of the shoulder here. That's the AC joint. I want to make sure that you go past that and you're onto this soft tissue part where the deltoid is. You're going to hook this band right around there. So we'll go into the fold of the shoulder, okay? Now the line of pull here matters, okay? So we're going to set it up here, but we're not going to pull straight back, okay? What you're going to do is you're going to pull back and to the side. So what I'll do is I'll set this up to where I'm a little rotated away, so this band is not just pulling straight back, because then you might be just pushing those bones together. What I want you to do is have it tilted out slightly to the side, and you're going to have your elbow set up in front of you, just like this, okay? And what I want you to do is I want you to just lean your body forward, like this. Lean forward, come back. Lean forward, come back. So instead of using my arm to rotate back, I'm holding my arm down and doing my body on my arm. But you can see this is still rotating backwards. And I have a line of pull here that is not pushing my bones together, but it's a slight distraction and it's slightly out to this angle. So I will lean forward, come back. Lean forward, come back. This should never be done aggressively. You will feel mild stretching, aching sensation, but never sharp pinching pain, okay? And also make sure, after you do your W test, if you don't have a restriction in motion, do not do mobility drills. I see a lot of people doing this gliding, stretching, because they think they're just supposed to. They already have full motion. They don't need any more motion, and all this is doing is irritating their shoulder and making it feel sharp and pinchy. Should not feel sharp pinching when you do this. Just a very low level ache would be like a 1 out of 10 intensity, and it's a stretch sensation, not a sharp pinching sensation. So now I'm going to teach you a stretch for the back part of your capsule, the posterior shoulder capsule, okay? You can do this as a dynamic stretch before your lift. You can do it as a static stretch after your lift to try to gain range of motion. That's not a set in stone rule, but generally I like to think of dynamic stretching before an activity and static stretching after between activity. But here's how we have to do this. We have to make sure that we're hitting the right target, because your shoulder joint, the glenohumeral joint, contains the humeral head and the glenoid cavity of that scapula, and they sit together like this, okay? If we pull the arm across the body and we're stretching this way, which this is going to try to target the posterior capsule, I want you guys to watch something. Notice what is happening at my scapula. If my scapula isn't sitting down on the rib cage, if the whole thing is moving whenever I draw my arm across my body, I am not going to target the posterior capsule on the shoulder. I'm just going to stretch the scapula across the body, okay? That's not an effective stretch. So what I have you do is, what I have people do is I'll have them press their shoulder blade against the wall. You can even walk your feet a little further forward and put some weight on it so it stays down. This arm will come up parallel to the ground, and you will press the shoulder blade against the wall here. And what most people notice is they turn their body slightly to the side, and that holds it down better than when they're straight forward. Hold the shoulder blade down to the side just like this. Okay, lean on the wall, put some weight on that shoulder blade, then take your arm, pull it across your body, just like this. You can bend the elbow and rest the arm here. You're going to pull this with this arm across the body, okay, just like this. You should feel a stretch on the back part of your shoulder right here. If you feel it on the front, you're not doing the stretch right. If I let the whole scapula come across, I might be causing some impingement here of the shoulder, okay? You should not feel it on the front, you should feel it on the back part of the shoulder. So again, press the shoulder down. Usually when the shoulder blade comes off the wall is when you feel it on the front, okay? Hold it up here, relax this arm because I can rest it here, I can relax my right arm, and I'm gonna pull it straight across my body. Make sure you maintain that parallel height. Don't drop down. Don't come above. Stay right here. Press it down. Pull it across the body. Feel the stretch in the posterior capsule, okay? Dynamic one is same position. You can glide. Static is just a pull and hold, okay? I also see people do this lying on the ground. But I like this stretch a lot more than what's called the sleeper stretch. The sleeper stretch, or the modified sleeper stretch, is when you're not completely on your back, you're slightly off to the side so that you are holding that against the ground. But then what people do is they put their arm here, then they stretch it downwards like this. This is just not as comfortable of a stretch position, and sometimes I see this causing impingement or anterior shoulder pain up here. Again, you should not feel it on the front, you should feel it on the back. That's a posterior glenohumeral capsular stretch. Okay, so now we're going to cover stabilization, and we're going to focus our time on the rotator cuff. Now, I know you guys have seen a lot of rotator cuff drills in the past, but there are so many mistakes made with this training. So first of all, if we're going to train the cuff and expect it to activate well in a certain position, we have to train that position. So what this means is if I set up a band right across here, okay, let's say it's right here. You see this all the time, rotation out in, and it's this whipping effect, just like this. This is how a lot of people warm up. Or maybe they're even doing teres minor and they have the band set up and they're pulling it back like this. Or they have a dumbbell in their hand and they're rotating it like this. Well, this is a better position to target the posterior cuff because that's the position we're going to get in for the low rack squat up here. The problem is the dumbbell way out here is going to give you maximal cuff activation. It's going to give you minimal cuff activation here. Why does that matter? You need the cuff to stabilize this position when you're under the bar. meaning the cuff's supposed to activate here, not just here. So while this is a good technique for targeting some of the posterior rotator cuff muscles, specifically the teres minor, we don't want maximal activation out here all the time. We have to train positions up this way. So a band in this position will give you maximal tension over here, rather than a dumbbell. And then down here at the side, this is not a bad exercise. It targets infraspinatus really well. Throw a pillow under your arm when you do it though, okay? And what I would do is I would angle this band slightly downwards. Now this is a heavy band. You may not want to use something this heavy. But if I put a towel under my arm here, okay, I'm going to increase the efficiency of that muscle by about 30% of that infraspinatus. That's a big deal. The other thing is, you guys have got to, so this is angled downwards, by the way, not straight to the side. It's going to give a little better position for that infraspinatus, but also keep in mind, you've got to slow this down. This whipping effect that I see, this is not a good warm-up. You're not going to maintain a good amount of tension in that rotator cuff when you're whipping things out fast, just like this. You've got to slow that movement down. We are not training for an Olympic lift here. Okay, that's a whole different line of training that I'm not covering in this video. With this, you just want to be able to hold the bar in that low rack squat position. Holding onto that bar means maintaining muscle activation. That's endurance. Train your rotator cuff to match what you want to do. Okay, so if I'm in this position with a band, okay, pull, hold. Now, this is one position, but that's not the complete low rack squat position, right? You don't squat up here, you squat down here, and you have to be able to pull that bar down. So, I can train my rotator cuff in that position to try to gain maximal cuff activation in that position and stabilize the shoulder joint well. So rather than just holding it up here, holding it down here, let's go over a couple ways to target it in the position you want. So I'm going to set up a band here in front of me, okay? Again, use a lighter band. These are powerlifting bands. I would not start with this. But you can rotate the arm into the position you need to be able to maintain, and you can pull it down to the side and practice activating the cuff throughout this range. You can practice isometrics, just holding it for 20, 30 seconds, or you can do some what's called perturbations, where you do small movements back and forth in that position. But your goal is to get to the end range position and to target that posterior cuff so it stabilizes the shoulder well while you're in that low rack squat position. Not just up here, not just down here, but in the position that you want cuff activation to be maximal during the lift. The last tissue we're going to go over for shoulder stability, okay, we covered teres minor, infraspinatus. Teres minor is a little more active as you raise the arm up when you're rotating back. Infraspinatus is a little more active as you're down here at the side rotating out. Both cuff muscles rotate out. Those are your posterior cuff muscles. Now let's cover subscapularis. And why does this matter? Again, we're talking about shoulder stabilization. We have to talk about the whole rotator cuff. Another thing you should be aware of is that as we're doing more and more stretching for external rotation, as you guys are trying to gain that mobility, you are stretching subscapularis. Subscapularis internally rotates. It's a strong rotator cuff muscle. But you guys are pulling on it and yanking on it, trying to increase range of motion from that muscle, and then you just expect it to be able to stabilize without training it. So, just like before, we've got to target the muscle to produce stabilization. What's the common way to do it that I see? Just like this. Just whip out and in 50 times before a lift. This is not going to cut it. That will not target subscapularis adequately, okay? And again, we're out of our position. We're down here where we might have good activation from an EMG study, which is valuable and important, but we expect it to maintain stability throughout this position, the low rack squat position. So, is this a bad way to train subscapularis? No, it's not. Slow the movement down. Make sure you're actually gaining maximal rotator cuff tension throughout this entire motion. Don't whip this. The whole idea when you whip it is that you're losing tension as you come out because you're just letting this band whip you out. But you expect to be able to fully externally rotate under the bar, and you want that to maintain its stability. Well, it won't if you don't practice, okay? And you don't train it. So, slowly rotate out all the way to your end available range. That full external rotation position, slowly rotate in, okay? Slowly all the way out, slowly all the way in. Now we'll train the low rack squat position, okay? So, put this band about shoulder height. Again, this is going to produce an internal rotation though, right? Because I have to fight this the whole time. Get your arm down in that low rack squat position and do some activation exercises. You can do isometrics, you can hold it, or you can do small perturbations, or you can do slow rotation, just like this. Okay? This is also going to target teres major when you're doing internal rotation, but we're kind of focusing on subscapularis here. So get your arm in that low rack squat position. Practice being able to maintain that cuff and that contraction of those internal rotators.